Opioid misuse and overdose are serious health concerns in the United States. Overdose deaths involving opioids doubled from 2010 to 2016, with more than 42,000 deaths in 2016. By 2018, opioids were involved in more than 46,800 deaths. The effects of opioid overdose and misuse are not isolated to home environments. Overdose deaths at work from non-medical use of drugs or alcohol increased on average 38% annually from 2013 to 2016. 217 workplace overdose deaths were reported, accounting for 4.2% of deaths at work that year. When injuries happen in the workplace, opioids may be prescribed. Opioid use is associated with risks, including opioid use disorder and overdose, with the consequences affecting both an individual's working life as well as their home life. Workplace risk factors that might lead to opioids being prescribed include unsafe conditions that lead to injury, such as slips, trips, and falls, or heavy workloads. Other factors such as job insecurity, job loss, and demanding low-controlled jobs may also be linked with prescription opioid use. There are drugs such as Naloxone that may temporarily stop the life-threatening effects of an opioid overdose. More than one dose of Naloxone may be needed to reverse some overdoses. Naloxone alone may be inadequate if someone has taken large quantities of opioids, very potent opioids, or long-acting opioids. For this reason, call 911 immediately for every overdose situation. Some business owners have incorporated a Naloxone use program in their workplace. Have you considered having a workplace Naloxone use program? NIOSH, a federal agency that studies worker safety and health, has developed solutions to help employers face the issue of opioid overdose in the workplace. Information in our fact sheet, Using Naloxone to reverse opioid overdose in the workplace, will help you decide if a workplace program for administering Naloxone is right for your situation.
Conduct a risk assessment. Decide whether workers, visiting clients, customers, or patients are at risk of an overdose. Recent studies show higher opioid overdose death rates among workers in industries and occupations with high rates of work-related injuries and illnesses. The need to return to work soon after an injury or to remain at work in spite of an injury may contribute to high rates of opioid-related overdose death. Workplaces that serve the public are also at risk. Places like libraries, restaurants, and parks may have visitors who overdose while on site.
Is your business or workplace at risk? Does your state allow workplaces to administer Naloxone? What liability and legal considerations should be addressed? Do you have the staff willing to be trained to provide Naloxone? Is there evidence of opioid drug use on site? Or has your workplace experienced an opioid overdose? How quickly can emergency response personnel access your workplace to provide assistance? Does your workplace offer other first aid or emergency response interventions? Are the risks for opioid overdose greater in your area or industry? Does your workplace have frequent visitors, clients, patients, or other members of the public that may be at increased risk of opioid overdose? If any of these issues are important to you, then consider exploring a Naloxone use program for your workplace. Establishing a Naloxone administration program. Conduct a risk assessment. Consider liability and other legal issues related to such a program. Set up formal procedures for documenting incidents and managing records. Assign staff roles and responsibilities. Train staff to lower risks. Plan for the purchase and storage of Naloxone. Store personal protective equipment for Naloxone use close by to protect against chemical or biological exposures, including opioid residues, blood, or other bodily fluids. Plan for follow-up care. Reevaluate your program periodically.
If you decide the program might be right for your workplace, the fact sheet can help guide you through the decision-making process. provide the information you need for a safer and healthier workplace, and get you started with establishing a program designed to meet your business or workplace needs. Please visit our website and download a copy of Using Naloxone to Reverse Opioid Overdose in the Workplace to find out more detailed information and links to other resources.